my channel. Today topic is the atherosclerosis, and I'm going to discuss this in very detail. So, what is atherosclerosis? Atherosclerosis means the hardening of the vessels. Athero mean atheroma, and sclerosis mean the hardening of vessels. In definition, we buildup of fats, cholesterol, and other substances on the artery wall. Before starting the atherosclerosis, let's clear some vocabularies. There are different type of words which are used for sclerosis, like arteriosclerosis, hyaline hyperplastic atherosclerosis, and atherosclerosis. And in this topic, we will discuss only this. The arteriosclerosis mean the hardening of arteries, and it is the main cause of this is the high cholesterol, the high blood pressure, and diabetes, and some genetic influences can cause the arteriosclerosis. The second one is the hyaline. Hyaline is simply the buildup of hyaline protein in the artery, which are called hyperplastic atherosclerosis. And finally, the atherosclerosis form of atherosclerosis and most common type is the atherosclerosis. You can see this in the picture. In this picture, this is the artery, and this is the normal lumen. This is a normal artery, and there is the plaque formation. This is the plaque. This is the plaque formation, and it is always in the eccentric position. It will not cross this all lumen. Let's know how the plaque formation accumulate in the artery wall. Plaque accumulation in the arterial wall. When there is a plaque accumulation in the wall, the chronic inflammatory response will begin in it. When it begin, the macrophage, the T cells, the T helper cell will involve in this process. In this way, the accumulation of lipoprotein, a type of protein, especially a bad protein, LDL, low density lipoprotein, will accumulate in the arterial wall. And these bad protein underlying and cause of many disease like myocardial infarction, MI, stroke, and periphery vascular disease. Before going to detail in atherosclerosis, let's summarize the arterial structure. It is important. If you understand this, you will easily understand the phenomena of atherosclerosis. There are three layers in the arterial structure: the main, the intima, the media, and the adventitia. Just like you see this in the picture, this is the tunica externa, this is the tunica media, and this is the tunica interna. And the atherosclerosis occur in the lumen. Intima is a single layer endothelial cell, and this is the basement membrane. Intima is a basement membrane. The second one is the media, tunica media, and it is based on a smooth muscle cell, and it contains elastin. Adventitia is a connective tissue, and it contains the vasa vasorum, where most of the blood supply to the artery wall and nerve fiber. There are different type of arteries. Not all arteries are the same in same types. Some are the elastic, and some are the muscular. Elastic are the large amount of elastin content. It have elastin in the middle layer, and it will expand in the systolic and contraction in the diastolic. And elastin present in the large arteries like the aorta, the carotid artery, and the iliac artery. In the muscular artery layer of the smooth muscle cell, and it have ability of the vasoconstriction and vasodilation to modify the blood flow. Arteriole, smallest muscular vessels which most flow resist. Just like I told you, the atherosclerosis are happen in mostly the large elastic artery, the aorta, the carotid artery, and the iliac artery. In the carotid artery, when in the carotid artery, the atherosclerosis lead to stroke, and the iliac artery uh, lead lead to vascular disease. It also occur in the medium-sized muscular artery. For example, the coronary and the popliteal artery in the leg. The pathogenesis of the atherosclerosis is unknown. Nobody knows that how it happened. Atherosclerosis, the endothelial injury or dysfunction. The detail of atherosclerosis is incomplete and understood. Incomplete understood. And there is believed to be related to risk factor. There are some factors which increase the risk of pathogenesis, like a cigarette smoke and high blood pressure and high cholesterol. It will increase the risk of atherosclerosis. Pathogenesis in the atherosclerosis, the main point of atherosclerosis is the branch point and vessel origin, which is ostia. This is the common site of plaque formation. The atherosclerosis mostly occur in the turbulent flow, not in a steady flow, because a turbulent flow can cause the endothelial stress and it damage the lumens. In the pathogenesis of atherosclerosis, in the lipids, the bad protein, the low density lipoprotein accumulation occur in the intima, and and that LDL oxidized by free radical. When the LDL oxidized by a free radical, it's scavenged by macrophage. When macrophage take this oxidized LDL, it cannot be degraded by the macrophage, and macrophage become form cell. And these form cell make a plug, and this plug formed in the arterial lumen, which is called atherosclerosis. Atherosclerosis, the pathogenesis when the chronic inflammation occur, the LDL, the bad protein oxidize from free radicals, and just before I told you, it damaged the endothelial and smooth muscle. And because of that, the macrophage release cytokines, and cytokines bring more inflammatory cells. And that's the reason the more macrophage bring the cytokines in, the cytokines bring more inflammatory cells and chronic inflammation occur in. So there is a question that how the atherosclerosis occurred and how the atheroma plaque formation occurred. The first thing happened in the atherosclerosis is the fatty streak. Fatty streak what is fatty streak? Fatty streak is a macrophage filled with lipids. It form line streak and along with the vessel lumen. It do not impair blood flow because it is eccentric. It's built in the one side of the lumen. It cannot be seen in children and adolescent. Not all progression. Before going to the atherosclerotic plaque, let's review the layer. In the lumen, this is a white blood cell, and that is a red blood cell, and this is the platelet. In there is some in these three layer. The first one is the intima, and this is the media, and this is the externa. So uh, this is the layer of artery. Atherosclerotic plaque. It happens when the intima thicken and the lipid accumulate in this intima, usually a patchy along a vessel wall. Mostly in the vessel wall, it will happen and rarely involved in the entire vessel. As I told you, that the plug formation will occur in the one side of the lumen. This is the top five location where the atherosclerosis occur. The most common the most common large vessel are the aortic, abdominal aorta, the coronary artery, the popliteal artery, and the internal carotid, and the circle of Willis. In the abdominal aorta, the ischemia is not happen. Why? Because the abdominal aorta have large surface area inside, so it's normally 3 to 4 centimeter large, but it's easy to make aneurysm in the aorta, abdominal aorta. Here's some complication of the atherosclerosis. The common one is the ischemia, plug rupture that exposes thrombogenic substances in a clot formation will occur, and it will cause and it may cause the acute vessel closure, which is ST elevated myocardial infarction, and this thrombus may embolize and stroke from carotid plaque. The another complication of atherosclerosis is a hemorrhagic into leg. It means the lesion mean proliferating small vessels and new small vessel proliferating small vessel mean a new vascularization and contain rupture may suddenly expand the lesion. And the another one is it will make the aneurysm. Aneurysm is a lesion may damage underlying media. The media layer will be damaged, and a plug associated with abdominal aorta aneurysm and plug associated with abdominal aneurysm commonly seen in a trauma.
When the trauma occurred, in these results, the chronic inflammation will start. And if there is a suspect of aneurysm, we can go for a coronary CT scan to investigate the aneurysm.
This is a picture of aneurysm, and whenever it bursts, it will lead to death. The atherosclerosis, the infarction may be occur in the complications. Infarction mean area of ischemic necrosis. There are two type of infarction. The one is white and the another one is red. First of all, we will talk about the white infarct. White infarction mean the occlusion of arterial supply. It will occur in the arterial supply, not in a venous. To a solid organ, most common heart, kidney, and the spleen because it happen because it is a limited blood supply or a single blood supply seepage from a healthy tissue, and whenever it will happen the tissue become pale, and that's why we call white infarction. In white infarction there is an example of a kidney, a renal infarction, and you can see clearly this is a white infarction in the renal. In the dystrophic calcification, as I told you, there's a two infarction, the white and this is the red one. In the red infarction, the hemorrhagic infarct, the blood enter to ischemic tissue and blocked off. It's normally happen in the venous drainage. This is happen in the testicular torsion in tissue with the dual circulation, blood flow from the second supply floods ischemic area. In classic location, the lungs where the diffuse blood supply are there, and small intestine. Flow establishment to necrotic area, angioplastic restore flow in coronary artery. This is a lung, and you can clearly see this is a red infarction happen in the lung. This is the red infarction, and this is the end of our topic.